you get a chance to ask Deirdre a question or two at the end when Robin will facilitate the question and answer session. But now I'd like to introduce you to Gwyn Vernon. Gwyn is the National Director of the Edmond J. Safra Visiting Nurse Faculty Program at the Parkinson's Disease Foundation. If that wasn't enough, she's also a nurse practitioner at the University of Pennsylvania Parkinson's Disease and Movement Disorder Center. She has been working with people with Parkinson's for many a year, but in between she's been the author of over 45 published articles on Parkinson's, including a comprehensive nursing care for Parkinson's disease. I don't know if that book's anywhere that be found in a good bookshop near you, if there's such things as bookshops anymore. She speaks nationally and internationally, and we're going to hear Gwyn talk about her and her team and the visiting nursing faculty and what that program does. Thanks.
Thank you, Malcolm. Sure. I'd like to really thank the program committee today. Truly honored to be here and be able to speak about our nursing program. Thank you, Eli, and the committee. Thank you, Malcolm. Also like to thank Max Kozlov from the Safra Foundation, because without their support, the program wouldn't exist. So thank you, Max. There I am. Okay, so what I'd like to talk to you about today, page down maybe, is there we go. It's just a little slow. Thank you. A program that educates nurses to educate nurses, basically. And I'm going to give you a little history about the program, tell you where we are, and tell you some of our hopes for the future. This is a little slow, I'm sorry. It's not moving. This whole idea kind of came as I might say, a humorous conversation. Thank you. Just space, okay, thank you. There are probably 5 or 6 of us left that started working with Parkinson's disease patients in the early 80s. We were all coordinators for information and referral centers for the American Parkinson's Disease Association. And we realized that we were getting older, and we weren't really finding that new young nurses were interested in Parkinson's and really wondered who was going to be working even in the Parkinson's disease centers in the years to come. And so it was quite a humorous conversation at first, but we began some conversations with the Safra Foundation, and we determined that there were a lot of different ways we could go. But first we wanted to find out, what are nurses learning about Parkinson's? When I was hired, I didn't know anything about Parkinson's disease. I met a wonderful physician who I thought was doing great work, and I tagged on. And I looked back in my nursing school notebook, and I had one line about Parkinson's, and the line was, L-DOPA, new drug, watch for it. And I can tell you, when we did the survey of need for this program in 2008, things weren't a lot different. And I'll tell you a little bit more about this survey in a minute. But in the timeline, we did the survey, the program began in 2009, and in 2014 we began a wonderful affiliation with the Parkinson's Disease Foundation in New York. So this is the results of the survey, and mind you, this was done in 2008, so it's not all that long ago. So what I knew about Parkinson's as a new nurse probably was still existing in 2008. We surveyed schools and looked at what kind of didactic component they had on Parkinson's. Less than 50 had any component on Parkinson's disease. We looked at what they were taking as far as clinical acumens to their students, less than 50%. And very importantly, those teachers that were addressing Parkinson's disease in the schools of nursing, less than 30% of them felt confident that they knew what they were teaching and felt like they had the knowledge base to be teaching about Parkinson's. We then had a team of nurse experts from the United States who work in Parkinson's Disease Center look at the materials that these professors were using in those schools that were teaching Parkinson's, we found that less than 3% were evidence-based or up-to-date. For example, one school was still teaching about drug holidays in 2008. So it was very enlightening and really spurred how the program developed and has grown since. So the process of the program really is to teach nursing faculty about Parkinson's disease so that they will teach nursing students. As we know, patients will be in all kinds of health facilities and in all communities around the world. So every nurse will run into somebody with Parkinson's during their career. So we want to educate student nurses coming out so that they have the basic knowledge of medications on time, for example, what on and off mean, that sort of thing. There's a standard curriculum which offers 40 nursing credits, and clinical time with patients is really the key. I think coming from a nursing background, you can read about tremor. Well, as you all know, because I'm speaking to the choir here, there are a lot of different kinds of tremor. So reading about it is not the same as seeing it. So the scholars is the terminology that we use for our nurse professors. They spend 2 days in didactics. They spend 2 days in mental clinical time seeing patients and working with patients. They participate in a Parkinson's disease support group, and they complete an independent project. We use host sites around, so far it's been around the United States, and the host sites are really academic movement disorder centers. So we rely on local centers that have the expertise in Parkinson's disease to help us teach the course. So for example, in Philadelphia, the University of Pennsylvania Parkinson's Disease and Movement Disorder Center staff is the faculty. Other sites that we use are Johns Hopkins University, Boston University, New York University, Oregon Health Sciences University, the San Francisco Pedrick, the University of Miami, Northwestern University, the Struthers Parkinson's Disease Center, and this year we will be having our first program in Arizona at the Muhammad Ali Center. So these are centers that have expertise in Parkinson's disease. They implement the standard curriculum. We help them along the way as far as the recruitment and getting the students there and everything that helps the programs run smoothly when they are going to happen. Our scholars have come from over 100 universities, and we've had scholars mostly from the United States, although we did have a scholar from Canada, another one from Nigeria, and one from Australia. But basically, as you can see, there are a lot of holes in the country, and as you can imagine, a lot of the scholars are coming because the program is somewhat close to them when you compare it to where our host sites are. So to date, we've used 10 different host sites, large academic movement disorder centers. We've had, by the end of this year, we will have had 220 nurse scholars representing over 100 schools of nursing. And through the work of these scholars, they collectively educate over 11,000 nurses per year, which sounds large, but when we consider that in the United States alone, there are 2.4 million nurses. So we're making an impact, but we have a long way to go. The scholars bring their content in very innovative and exciting ways. I love this part of the program because I learn a lot about teaching and our modern generation, I think. Simulation laboratories, we have now Parkinson's disease simulation laboratories in several universities around the country. They use online modules. They've done interprofessional education. There was a scholar in New York who worked together with a pharmacy school and also the physical therapy school, and they put together a joint education program where the students of all of those schools joined together to learn about Parkinson's. One very innovative scholar in Baltimore realizes that the young generation loves technology, so in order to teach pharmacology, she had her students do YouTube commercials on the various Parkinson's disease medications. They had great fun doing it, and they learned a lot in the process. There's a huge secondary impact beyond teaching the nursing students in the universities. We now have PD content in several state educational repositories for nursing faculty. What these are repositories online that nursing faculty from any school in that state can go and access and borrow and use materials that another instructor has used. So we now have several Parkinson's disease case studies and lectures and that sort of thing on a few of the statewide repositories. We now have a case study on Parkinson's disease in what is mandated in this country as far as quality and safety education training for nursing students. QSIN is the acronym for that. Every school must teach quality and safety, and we're happy to say through the work of one of our scholars that now the module that they learn about falling, which is a huge safety issue, is a patient with Parkinson's disease. So they're learning it in a various numbers of ways. There are now questions on the State Board of Examiners to pass your RN license in the United States on Parkinson's disease. There were none prior to 2011. And the National League of Nursing has recognized the program as being very innovative and building the future of nursing, so we're very proud of that. But in addition, our faculty scholars are scholars. They're academic professors, and they do a lot more than teaching in the classroom, although that is so important to our mission. Many of them do nursing research on Parkinson's now. Several have become involved in their local communities and started exercise groups, dance groups, singing groups, all of the things that we've been talking about throughout the day. They do a lot of publishing. So there are articles now appearing in journals where none were in print before. For example, one of our scholars whose background was in skin and wound issues published the first article in the nursing literature on skin and wound issues in Parkinson's disease. And as you know, the seborrhea and the dry skin and that sort of thing really do impact a patient's quality of life. Also, these scholars speak nationally, locally, and also internationally. So we've had many of our scholars who presented at organizations that many of us that are experts in Parkinson's disease locally don't belong to. For example, the American Academy of Nurse Practitioners, the American Association of Emergency Room Nurses. They are infusing the knowledge about Parkinson's disease into various other nursing niches, so to say, and are very successful at doing it. They also travel around the world. Nursing schools have become very focused on global health and international health efforts. So several of our scholars in their work for their university have been able to travel to other countries and do a project regarding Parkinson's in that area. For example, in Nicaragua, one of our scholars went down and worked with the community health workers there on educating about exercise. She took 10 students with her, so those students learned more about Parkinson's as well. They've been to Africa, India, certainly the European stations, and this summer one student went to Mongolia. So we're very proud of the efforts that they continue to make and to continue to infuse their knowledge about Parkinson's disease outside of their classroom as well as in the classroom. We actually have 12 scholars presenting here at the World Parkinson's Congress, which really is exciting. These professors not only teach about Parkinson's, they have to teach multiple topics, but they've found it in their hearts to really focus on Parkinson's and to continue their education by attending this conference and also presenting work. So please do stop by at any of their posters that you see and welcome them. So our conclusions and future directions. We know that nurses in all settings, in all countries, in all facilities will run into people with Parkinson's disease. There are a lot of people with Parkinson's disease in the world. I think we learned this morning 6 to 10 million. Nurses are everywhere as well. We want nurses to be able to understand at least the basics about how to care for someone with Parkinson's disease. We don't want them coming out of schools knowing one line, levodopa, watch for it. So we have a lot of work to do yet. And to do that work, we really are looking to develop new partnerships with additional Parkinson's disease leaders and leading groups. Also to expand our program into new host sites so that we can get it into more areas, not just in the United States, but hopefully eventually even internationally. And to recruit scholars from more locations. If you think back to some of those maps I showed you, we've got some real holes in just the United States alone. So it's a start. I look forward to many future years in developing this program further, and I really am glad to have the opportunity to talk with you all today about it. Thank you.